What is the role of neurotransmitters in schizophrenia and depression? Have you ever wondered how the brain's chemistry affects our thoughts and feelings? Neurotransmitters are the chemical messengers that play a vital role in this process. They help nerve cells communicate and regulate functions like mood, cognition, and perception. In conditions like schizophrenia and depression, imbalances in these neurotransmitters can lead to a range of symptoms that overlap between the two disorders. In schizophrenia, dopamine is a key player. The dopamine hypothesis suggests that too much dopamine activity in certain areas of the brain, especially the mesolimbic pathway, is linked to positive symptoms. These include hallucinations and delusions. On the flip side, reduced dopamine activity in the prefrontal cortex is associated with negative symptoms, such as lack of motivation and cognitive difficulties. Different types of dopamine receptors have distinct roles. For instance, overactivity of D2 receptors is related to positive symptoms, while changes in D3 receptors may affect motivation. Glutamate, the brain's main excitatory neurotransmitter, also has a significant role. Issues with glutamate signaling, particularly involving N-methyl-D-aspartate receptors, are observed in schizophrenia. Reduced glutamate activity can contribute to cognitive impairments and negative symptoms. Other neurotransmitters like gamma-aminobutyric acid, serotonin, and acetylcholine also show altered functions in schizophrenia, impacting emotional processing and cognitive regulation. When schizophrenia coexists with depression, the situation becomes more complicated. Depression is often linked to low levels of serotonin and norepinephrine, neurotransmitters that help regulate mood. In cases of schizophrenia with comorbid depression, the disruptions in dopamine and glutamate systems may overlap with serotonin dysfunction. This can worsen symptoms like low mood and cognitive difficulties. Overall, schizophrenia involves a complex interaction of multiple neurotransmitter systems, rather than just one chemical imbalance. There is hyperactivity of dopamine in some brain circuits combined with reduced activity in others, along with glutamate and serotonin abnormalities. Understanding the roles of these neurotransmitters is essential for developing effective treatment strategies. These may include antipsychotic medications that target dopamine, antidepressants that affect serotonin, and new therapies aimed at glutamate pathways. In summary, the relationship between neurotransmitters in schizophrenia and depression is intricate. Excess dopamine activity in certain pathways leads to positive symptoms of schizophrenia. Reduced dopamine in other areas contributes to negative symptoms and cognitive deficits. Glutamate dysfunction affects cognition and negative symptoms. Serotonin and other neurotransmitters influence mood and emotional regulation, linking schizophrenia with depressive symptoms. Comorbid depression in schizophrenia reflects overlapping neurotransmitter disturbances, complicating treatment approaches. Addressing these multiple neurotransmitter systems is vital for managing both schizophrenia and its frequent co-occurrence with depression effectively.